Okay, so this is the second hours of our lecture. Um, Now, this um, figure shows you what happens during the cell cycle, and that is this thing doesn't do its justice, and that is the cells, in fact, spend a little time in mitosis, not like this. If you say this is the time frame of a cell, it does spend most of its time into this interphase. And in mitosis, you can see there is divided up so that it becomes like a pure prophase, metaphase, the chromosome, sister chromatid line up. One line's a centromere, and then the sister chromatids pulls apart uh, by the spindle that is formed by the centrioles here, and then it becomes two cells. Mitosis, and then it spends most of its time in G1. I draw this line here is that's a critical point. That's a check. We call it the G1S transition. Is typically given the right signal, particularly right growth factor, it goes into the synthesis phase. And the S phase means it duplicates the chromosome synthesis. And so once it's duplicated, it's ready to divide. All right, so then now you know a little bit about cell cycle. Um, in fact, there are different kinds of tissues depends on whether the tissue has stem cells or not. If the tissue has a lot of stem cells in there, that means they're constantly dividing. Um, and and in terms of if there's a DNA, if there's a damage of the cell, one of the repair mechanism that this um, tissue or organ that have stem cell, they can typically regenerate themselves. Okay, so things like these right here, liable tissues would have stem cells that would, if there is damage, it can basically repair itself. But on the other hand, what we consider as permanent um, um, cells within that tissue, if that is the case, then the cells or the tissue, sorry, if there's damage and they cannot regenerate, okay, and if they cannot generate, typically you will see that scarring will form. If it's regenerate, then of course there's no scarring. And your job is to understand, or to know some of the example of organ that have liable cells, right? That tend to be usually short-lived, like the GI tract, the skin, um, and so forth. I can see bone marrow, epidermis, GI tract, bronchoepithelium. Okay, these will have stem cell, and the lining typically can regenerate itself. Mhm. Um, and in fact, because these cells are constantly dividing, um, if you treat patients with certain chemo, we call it chemotherapy, some of the drugs like Taxols and stuff like that, that target dividing cells. Uh, right now, if you take that drugs, it goes everywhere in the body, and of course, these cells will be affected as well. Right? And so people under chemotherapy or some radiation too to target cancer cell, the consequence is that you will see that people have diarrhea because the GI lining have those cells. They might lose their hairs because the follicular cells, um, hair follicles have cells that are constantly dividing and they're going to fall off. Um, Now, on the other hand, uh, the tissues that have permanent cells um, are cells that cannot divide. Typically, say the nervous system or the heart or the skeletal uh, are cells that don't divide. And for those cells, for example, the only repair mechanism, it cannot go through regeneration, and it has to form scar tissue. Right? typically your skeletal muscles do not divide. Once you have it, that's it. Cardiac myocyte, once you have it, is there. It doesn't divide anymore. So if you damage your heart, I'm sorry, but most likely you're going to have a heart replacement. So ischemia, a blockage of coronary artery that leads to myocardial infarct, which is another word saying necrosis in the cardiac myocyte. You cannot have more cardiac myocyte regenerated. You have to have either fibrillate a pacemaker to help you heart to contract, or you have to have a heart transplant. Simran, itchy finger again.
Hi,
Simran,
could you explain afibrillation a little bit more, or is that off topic? If it's off or after class, maybe. I was just a little curious
I can
about
tell
that
you
one.
right now.
Okay,
Okay,
thank you.
now um, the heart is unlike the skeletal muscle, and that is um, skeletal muscle will contract until there's a motor neuron innervates it. But um, the cardiac myocyte is considered a self-excitatory. That the there is a place called the SA node that undergoes spontaneous depolymerization because it has a leaky sodium channel. And so when it depolymerizes, it causes a wave of depolymerization to the two atria first and to the two ventricle. Okay, and it does this rhythmically. In other words, every uh, minute there should be 100 spontaneous depolymerization. But because of the vagus nerves, keep it down to about 75 beats per minute. Um, Now, there's a rhythmic to that. And when you say that um, and one of the functions of the heart is um, to contract and relax. And during that relaxation period is very important because that's when it fills with blood and then it contract again and then to eject that blood. And so the heart is like a pump, but in order for it to be a pump and work it, it has to be filled with blood so it can pump it out. The problem with fibrillation is that it it contracts too fast, right? And it doesn't have time for it to fill with blood. And AFib, like the atrial fibrillation, for example, is when there's dysregulations of the normal beating. So typically it should be 75 or 100 beats per minute, but it's faster than it's supposed to be. And if it's firing faster than it should be, that means contract faster than it should be, that means it's not going to fill with blood as much as it should be. And that's the problem. So you have to need to control that. AFib or fib, a full fibrillation, in fact, is like the heart is fluttering.
Right.
It can do anything, and then you have to reset it into sinus rhythm. That's why you might see on TV, clear, boom, you shock it to
Right.
reset the system.
So
Okay.
when a patient goes into afibrillation, does the weight, like when you're looking
Yeah, you
at
can look
their,
at the EKG.
right, the EKG, it would be super sporadic, right? Like smaller waves?
Yeah, yeah, yeah. We're going to see all that. Yeah,
Okay, all right. Thank you.
yeah, yeah. Um, okay. So there are three different kinds of tissue: liable tissue, permanent tissues. Of course, these have different liable cells or uh, permanent cells. And then they're stable that you see here. Tissues that have stable cells typically don't divide, but they can. And these two will be the liver and the kidney. Okay. And again, they would have stem cell, but they're differentiated. So all of these stem cells here we'll consider as a multipotent stem cell. So the liver is one of those very interesting, and that is it can regenerate itself. In fact, in liver transplant, 20 years ago, they thought that you need the whole liver to transplant it to the individual, but now you can just need a part or a lobe of one liver from a dead person and then transplant it into an individual. That liver cell can repopulate, yeah, and depends on the body need. And Um, in fact, liver is one of these organ that you only need about 10% of the liver, even less, to survive. So if a person who drink a lot and their cells become form scar, we call it cirrhosis. Cirrhosis of the liver could you could see it for years until up to 90% of the liver is cirrhosis, uh, and the person might be normal. When it's 100%, liver's not function, then you can start seeing ascites, jaundice, icterus, all these things that due to liver failure, right? Or yeah, liver failure, then you can see it. But up to 90%, you still liver still working fine. And of course, that will require years of drinking. Anyone have question regarding the stem cell and the involvement of the repair? Depends on the tissue. Now, again, permanent tissue have permanent cells, um, like say the brain or the heart. The only repair they have is will lead to scarring. That's it. Okay. Whereas these other two, uh, if the damage is minimal, you can get regeneration. Regeneration meaning that it go back to normal what it used to be. Um, but if it's extensive, then it could lead to scarring as well. And you probably see this also. A good example is that, in the skin, for example, if you touch something that's hot, right, you have a response um, in that area that's hot. Um, and then, maybe 3 or 4, a week later, that area might be peeled, and then it's recovered, regenerate. But if you get an acid burn that is damage deep to the tissue, the the of course the repair mechanism afterward will lead to scarring. If it's very superficial, you're gonna be the same. You're probably not gonna notice it. But if it's deep, extensive, then it's gonna have scarring. Okay, so what are some of the potential uh, substance or environmental factor that could cause a cell injury? Um, we're talking about um, anoxia mean no oxygen, hypoxia mean little oxygen, ischemia is refers to blood flow. Ischemic mean less blood flow. Less blood flow could lead to hypoxia or anoxia. Physical trauma, certainly, you can see that through bruising, someone punching in the face, um, or if you running a marathon that you body's not prepared, for example, you can stress the cell, or a skeletal muscle could die, for example, because of too much physical activity. Chemical substance, acid burn, certainly. Radiation is the most dangerous thing because it can cause DNA damage. Nabila, do you have a question? Um, Toxins, bacterial toxin can stimulate the cells um, to respond to it. It can cause a cellular injury to the toxin, some toxin. Bacteria, micro, inflammation. In general, you think of inflammation as a good thing, but too much inflammation could be a bad thing. And we see this an example with coronavirus, COVID-19, for example. Um, for some individual, um, when their body is infected with the coronavirus, upper respiratory tract is okay, but once it goes down to lower respiratory tract, they may get we'll call it the cytokine storm. So the word cytokine is good to know. Okay. Cyto is refers to cell. Kine are like kinetic or movement. So cytokines are molecules that stimulate um, cells to move. In other words, okay. So we call that cytokine. Um, it sometimes there's a special kinds of cytokine known as chemokine, uh, and that is it. A lot of those chemokine molecule has a amino acid cysteine next to cysteine called CC chemokine or CXC, and X could be any kinds of amino acid between the two cysteine chemokines. Um, but the general, the molecule that stimulate the immune cells to move, for example, we call that cytokine um, and chemokine. The yeah, and with the COVID-19, for example, you have we call it cytokine storm, and that is there too much um, molecules have been released, and a lot of these molecules that release, in general, they're considered as pro-inflammatory uh, cytokine. Right? TNF alpha, tumor necrosis uh, factor alpha, interferon gamma, interleukin 6, they're all cytokine. Okay, um, and uh, and because they have they recruit, if you will, a number of immune cells to the lungs, and they can stimulate the cells to vasodilations and so forth. Thus, you can get a lot of fluid accumulations in the lungs, therefore interfere with the gases exchange called the respiratory membrane, and the person might not take in oxygen as much. Then that person has to be on a ventilator to help them breathe, for example, okay, or be intubated. The um, and one way to treat this is that we know that the general steroid, steroids are good immunosuppressor, if you will. Dexamethasone is a good immunosuppressor. So let me write this down. Steroid, example, uh, dexamethasone. Okay. Steroids. Say steroids are good immunosuppressor. Okay, so immunosuppressor mean that they prevent your immune system from working, and so um, if someone who has problem breathing, and you can certainly check their oxygen level, blood oxygen level should be like around 90, 95. If their oxygen level is low, 50, 60, they cannot take in as much oxygen as needed, then that person has to breathe through oxygen, 2 liter, 10 liter, 20 liter, or so forth, and 20 liter of oxygen breathing, then that's a very grave situation. Um, you might want to give them remdesivir, for example. Regeneron, who gave it to the President Trump when he had it. But in severe cases, you can give them remdesivir or dexamethasone, okay, which is steroid. So then people say, oh, once you're on that steroid, you get this high hallucination, euphoria, feeling great, and stuff like that. Okay, but um, keep in mind that steroid or immunosuppressant. A good way to think of it is whenever you have poison oak and poison ivy, what do you go? You go to the grocery store and buy these like cortisone, for example. That's a steroid, and you atopically you apply it on your skin, and it will suppress it, reduce inflammation and so forth. Okay. Um, so cytokine, pro-inflammatory cytokines, good pro-inflammatory cytokines are TNF alpha. Uh, TNF stands for, initially it was discovered TNF alpha has killed cancer, so hence the name tumor necrosis factor. But it's more than just um, um, involved in killing cancer cells. Um, inter, Interleukin, IL-6. There are many kinds. There's tons of them. Um, Often IL-6, IL-2, IL-10, but IL-4, IL-6 is a major one. Okay, the word interleukin means leukin as in leukocyte, inter mean between. So these are the mediator that is acting between white blood cell. Randy,
Can you explain the TNF again?
TNF is a pro-inflammatory cytokine. Okay. Their example of pro-inflammatory cytokine. And the original, they're thought to kill cancer cell, but in fact, it's activated one type of cells called cytotoxic T cell, right? And involved in killing cancer cell. But we'll find out that cytotoxic T cell is involved in killing virus infected cell, for example. So when you have coronavirus infection, the cytotoxic T cell will be increased. And it increases activity because of TNF alpha. So in general, we call them their pro-inflammatory cytokine. And then one more. I'm going to write it for you. Uh, Interferon gamma. G is gamma. There's interferon alpha and beta too, but interferon gamma is the major one. And they're all pro-inflammatory cytokine. They're involved in inflammation response. Okay. Uh, Inflammatory cytokine, immune reactions. Nutrition is very important. If you don't have the proper vitamin D or vitamin C, you can exacerbate, well, you could slow the healing process. In fact, recently, study shows that um, people with COVID-19, um, in fact, they look at the severity of the infection versus vitamin D deficiency, and it finds out that a number of them, significant number of patient that lacks vitamin D and its association with severity of COVID-19. So, um, does it help to take vitamin D to prevent the onset or perhaps speed up the recovery of the infection? Vitamin D doesn't hurt you, help you uh, absorb calcium to the small intestine. I do it. You should take it. Vitamin D. Here's my. This is what I take um, to supplement my anti-COVID-19. See that? My vitamin D. I also take vitamin C, and I also take zinc. These are the three recommended vitamins. I take it. You can do whatever you want. But yeah, certainly nutrition or lack of it causes DNA or the cells damage, or doesn't help it to work its normal function. Okay, so genetic and metabolic. Certainly, DNA radiation can damage the genetic material. Um, and just face it, we all going older, and as you get older, it, it's your everything kind of slowed down, and even your immune system is not work the best. In the case of coronavirus, for example, it hits hard within the certain population, elderly for especially hit hard because once they get infection, then for many of them, it's harder to recover. And that's why, if you're age 65 and older, you are in the group two, qualify for getting the vaccine, for example. Group one is the first responder. Now, if the key here is that the insult, we call it general insult, is a stress that is minimal or mild, you're going to get these self changes. Okay, so all of these, maybe not uh, dysplasia, but atrophy, hypertrophy, hypoplasia, metaplasia are all reversible. Your book say dysplasia is reversible. I'm going to say that this is irreversible. Is irreversible. Now, atrophy, hypertrophy, hypoplasia, metaplasia is reversible. Reversible because um, if you have muscle atrophy, you can maintain a more muscle mass, right? If you start working out, for example, astronaut who goes up, who the space station for months or years, they're not using their muscle. Their muscle is goes to atrophy, and atrophy, I mean, decreases the muscle mass. But you come back, you're not immediately, but you're working out, you will see that you can build up that muscle mass again. And muscle atrophy is very common. If it's work on this ideas that use it or lose it, and you can see that uh, patient who's in the wheelchairs for many years, they don't use the leg, the muscles in the leg will get smaller. You know, and you know that there's a show called CSI. New Orleans, I think there's a guy who's like a computer expert, is in a wheelchair, and you look at this and you say, oh, this guy is an actor. He's not a real person who is a paraplegic. Is because you look at his leg, muscle in his leg is big, right? They got no way, dude. If you sit in a wheelchair for many years and you lack the motor neuron to innervate your skeletal muscle, no way you're gonna maintain that muscle mass. You're gonna lose it over time, and you lost it to atrophy. Hypertrophy is the opposite of that. In fact, hypertrophy is defined as increases in the size of the cell. Okay, that's hypertrophy. Hypertrophy is the increase in the size of the cell. Because your skeletal muscle, for example, do not divide, but you work on conditioning. You work on weight. Your you see that hypertrophy is the increase of the size of the cell, and what that means is that instead of looking like this, it's going to look like this, bigger. And that, if this is skeletal muscle, you get more actin, more myosins in here. Okay. And by taking a lot of albumins, a lot of protein supplement, you can help make more actins and myosin. And so that cell is known as hypertrophy. On the other hand, hypoplasia is increase in cell number. Right. hypoplasia is increases in the cell number. So you can go from, say, here to this. That's hypoplasia, or we call that hypoplastic cell. Right? Metaplasia is actually changing the cell's morphology. If they're columnar, now they become squamous, for example. They might have cilia and they lose the cilia. That's known as metaplasia. Dysplasia are the word dys mean irregular or abnormal. Okay, dysplasia. And dysplastic cells tend to have a darker nuclear staining called hyperchromatic, and they loses their orientation, if you will. Right. Here I'm going to write here next slide here. Dysplastic cells. So I ask you dysplastic cell characteristic. You would say characteristic. Hyperchromatic staining and loses the cell orientation. So then they no longer know what is the top versus the bottom. So we call it apical versus base, right? And so if they loses that cell orientation, cells can pile on top of each other. So here are some of the characteristics we call dysplastic cell. Well, dysplastic cells are hypochromatic. So in other words, the nucleus will stay darker and it loses the cell orientation. They don't know what is the top, what is the bottom, and so they just divide, piling on top of each other. I think there was one question. Someone have a question? Someone want to raise their hand?
That was me, Professor. I was just, when you said metaplasia, you said the change of cell, and I didn't catch the rest of it.
Oh, yeah, cell morphology.
Okay, thank you.
So we come from columnar to squamous, for example. And I have example to show you. Okay, so let's go through this briefly. When you have a self-injury, it's mild, you can get these cellular changes here. If it's severe, of course, leads to necrosis. You cannot argue with that. Now, if it's mild, acute, and acute meaning that it's onset, you typically see what we consider hydropic. Hydropic refers to as fluid accumulation or water accumulations in the cell. Okay, you can see that hydropic. Or fatty changes. And fatty changes within the cell is known as steatosis. Okay. When I ask you for cellular changes, what's another word for cellular changes? Is steatosis. Okay, not fatty acid liver. That's different cell. That's the liver. Okay, but steatosis. The cell might respond to certain, say, if there's a chronic injury, having many intracellular particles accumulation. What are these? They could be fat, cholesterol. We'll talk about some of them, glycogens, or carbon pigment, and so forth. And adaptations are these atrophy. We talk about hypertrophy, hypoplasia, metaplasia, and dysplasia. All of them, right, except dysplasia, even though the books say the dysplasia is reversible, I say it's irreversible. Okay. All right, here's our some of the changes that you might see considered reversible is mild. Here, see, you can see water accumulations, in this case, hepatocyte. Here's a good example of what does pathophysiology mean? In this case, what you see is a histological slice of cells that have fluid accumulation, particular water here in the cell. Okay, uh, over here is your normal cell. Here's your a lesion, if you will, of cells that are changes, right? So for us, and what this class is about is to understand how does this becomes this. What is the pathway? What causes that? Well, it turns out that liver cells, like many cells, require oxygen um, to make ATP, for example. And for many cells, they have this um, um, call it the sodium potassium ATPA. Okay. Now, if you don't know this already, start learning now that intracellularly you have high concentrations of potassium. Okay, and extracellularly you have high concentrations of sodium. So whenever you have, say, a sodium channel open, sodium will comes in. Okay, whenever you have a potassium channel open, right, potassium will comes out from high to in. But once the cell's inside, right, this transporter, if you will, sodium potassium ATPA, is in fact is pumped out three sodium for every two uh, potassium that it takes in. So over time, there's more positive charge on the outside or more negative charge on the inside. We call this is polarized membrane. Neurons require this polarized membrane to cause an action potential, for example. But because there is no oxygen, you don't have the ATP to pump sodium out, right, into the against its concentration gradient, for example, going from inside out, from low to high, require ATP. So therefore, sodium accumulates in the cells. And wherever there's sodium, there's water. Okay, so that's why you have hydrosis. Okay, um, and here's what process known as, you can see here, hydropic cells, hydrosis occurring within this hydropic cells. All right, here's another one. This is steatosis, is mild due to fat accumulation in the cells. Now, in the liver, for example, you might have fatty liver, and usually because alcoholic might have fatty liver first before they get into cirrhosis, and that is because the degradations of alcohol will make it into this intermediate that interfere with the redox potential. Um, in other words, NAD positive versus NADH. Therefore, it's interfere with the breakdown of fat, if you will. Therefore, you get fatty liver accumulation. So, fat accumulations in the cell is known as steatosis. Okay, so make sure you know that. Steatosis. Here's, you may see the similar thing, steatosis occurring in the kidney. Particularly here, most of these here, this is the cortex outside and the medulla. And you can see how fat accumulation, some fat in there. Simran?
You said that alcoholics might have a fatty liver. They have fatty liver accumulation before steatosis.
No, um, if you see the cell that has fat, that is known as steatosis. Okay, and the liver that has steatotic cell is known as fatty liver. Okay,
Okay,
it's before cirrhosis of the liver. Now,
cirrhosis. Okay,
cirrhosis is weird because there's a process that occurring that the first thing it does is that it stimulates the cells to proliferate, and the cells do divide, but they still surrounded by the stromal cells. Okay? Um, and ultimately it cuts off the supplies, and the cells become more leather-like. So that's why they call it cirrhosis. Now, other accumulation that you often see in smoker, particularly um, um, people who smoke a lot, and that is you might see this pigment, this carbon particle accumulates in the cells that you see here. In the case of a smoker, for example, and some of these might consider as a mutagen. Mutagen is a compound that is mutate the DNA. It's called mutagen. Uh, Atrophy, be careful here. You just have to take the author description that if you look at a cross sections of a um, muscle mass that you can see here, what looks like is a um, paramecium, um, and you can see how it's pretty big, and here is very small, and this is big, so that's considered as atrophy. Well, um, you can take that as an idea, as a general idea, but just mindful that when a lot of sections of the cut, um, you have to know where the locations of the cut, because uh, let's say, for example, here is a bicep brachii. Okay. And if you cut here or if you cut here, right, you're going to it's going to indicate different uh, just general ideas. If you cut here, for example, you can see how this whole muscle mass itself is big. It's down here small, right? Now this is the whole muscle, but you can look at the individual paramecium and it's the same idea, right? That if it's tapered, then obviously it's going to be small. And so having seen something small does not necessarily mean it is atrophic cells versus this one. Um, your yeah, you have to take the history with this as well to see. Um, is there a question? Someone raised their hand. Oh, no.
Uh, all of these are reversible, right?
Atrophy is, yes. Hypertrophy is, yes. So what you see here, the hypertrophy is defined as increases in the cell size, right? Increases in the cell size. So not from here, but to here. But because there are many, then the tissue will become big. So in this case, this what you're seeing is the here's a right ventricle, here's a left ventricle. And left ventricle wall typically is thicker than the right one, right? But it's this. But there, the lumen is, there's space here. But if someone who has chronic hypertension, right, uh, the downstream effect of someone who has chronic hypertension is that the left ventricle walls have to work. The left ventricle has to work harder, and in this case, the hypertrophic wall. You see that, and the lumen now is small. because cardiac myocytes do not divide. They get bigger due to hypertrophy. Hypertrophy is increase in the cell size. Hypoplasia is increases in the cell number, right? And then a typical normal GI tract, for example, you might see it here. So GI tract tend to have, we'll call it single cell columnar epithelial. Okay, so it's single cell, let's say columnar epithelium. Is a typical of gastrointestinal tract, small intestine. And you only supposed to be single cells here. And then there's a lamina propria down here, muscularis externus down here. Now you can see here or here, there are multiple layers of cells. Okay, now these cells here know its orientation. The orientation is that toward the lumen is the the apical, right, or the apex, as you will, the top, and down here where it might form, say, semi hemidesmus. It has attachment with things like hemidesmosoma, for example, right? So that's the basement layer, and it probably form links to the nearby cell. So know the top versus the bottom. But once they lose that orientation, they start like powering off each other like this. And you see how it's darker staining? That is dysplasia. But here, it is still kind of like 2 layers of cell, but not so dark staining. So this is still hypoplasia. Okay, and this is dysplasia, which then can grow on bigger to become carcinoma in situ in the gastrointestinal tract, for example. So hypoplasia versus dysplasia. You can see how dysplasia has characteristic of darker staining nucleus. What's another word for darker staining nucleus? Hyperchromatic. Hyper means more. Chrome is color. Hyperchromatic. Okay, and metaplasia here, how you can see the cell changes the morphology. In, let's say this is a respiratory tract, columnar, ciliated columnar epithelial cells, smoker progressively changes into the squamous metaplasia. And they're flat and they probably lose the cilia. Now, if you stop smoking, it can come back, right? Dysplasia, again, this tells you the dysplasia. More cell but darker staining. Here's a normal staining cell, okay? And see how darker it is. This is very scary looking, if you will. And particularly here, down here, the cell, if it's still within its cell, within the confine of the basement membrane, we call that carcinoma in situ, but they started to come inward like this. Now that's metastatic or invading, if you will, cancer, and that's very dangerous. All right, now let's stop here and let's take a 5-minute break. I'm going to stop the recording.